Hi, welcome. I'm trying to learn medicine. Today, common cold. And after we've done it, we're gonna do stretching. And if you participate in the stretching, then it's at your own risk. And this is no medical advice. So we're just reading about it. This book is from the 80s. This is no medical advice, we're just reading about it. And this book is... Common cold. A highly contagious virus infection, more usual in winter months or common all the year round. Okay, the common cold is easy to transmit to another person and it is more usual in winter, but it can happen for all the year. It can be caused by many different viruses, and as these are constantly changing, any immunity developed from one infection may not protect against further infection. Okay, there are many different viruses of them. And they are mutating, constantly changing, and therefore people cannot develop immunity. Immunity developed from one infection may not protect against further infection, because there are many different viruses and they are mutating. However, some immunity is developed over the years, and adults are usually less vulnerable than children. Okay, they are saying that adults are less vulnerable to get ill as children are. Maybe. The following groups of individuals are Now, I just saw something about that. Prevention. Regular exercise, stop smoking. What if, because kids are probably not smoking, what if this is even distorted? What if even less adults would be ill if they would not smoke? What if something like that, because the adults have it already less because they have a little immunity, maybe. But what if they're having behavior like smoking, which the kids don't have, the following groups of individuals are at special risk. The frail and elderly, babies and the very young, patients who are obviously ill or who have a persistent fever for more than 3 days. Okay, so people who are frail, whatever that means, and people who have aged longer, and also babies and very young people. And then also patients who are obviously ill or who have a persistent fever for more than 3 days. But don't they get the persistent fever from the common cold? Now, how are we now in particular vulnerable to get the common cold? Do we not have it already? Whatever. As you see, this is no medical advice. We're just reading about it and reacting to it, speculating about it. The virus affects the whole upper respiratory tract, producing a swollen, inflamed, leaning to the nose in particular, and also the throat and often the sinuses and larynx, the voice box. So the virus affects the whole upper respiratory tract. It produces a swollen and inflamed leaning to the nose. Lining to the... Something is swollen, something in the nose, some line or whatever. And also the throat and often the sinuses and larynx. So the sinus are we have 8 of us or 4 paired. They are swollen, so they block the nose, and also the larynx is affected in the throat. It's called throat. Okay. Mucus from the nose is loaded with viruses, and the air breathed cold. Also, the air breathed? Even I just forgot them because we're talking about the nose. The air out of the nose is infected with viruses. That would be interesting. It would be strange if not. So mucus from the nose is loaded with virus. So the mucus in the nose is the virus is full, and also the air breath out and coughing and sneezing out by an infected person may infect others in the vicinity. Okay, people can just infect I don't know, yeah, other people if they're breathing. Symptoms: sore throat, headache, and a stuffy feeling in the front of the head. A stuffy feeling in the front of the head. Running nose. The discharge is clear and runny at first, later becoming thicker and greenish yellow. Tending to block the nose. Sneezing is coming. People are sneezing, having thick and greenish discharge out of the nose, At the start it's more clear and running all the time. A core which may be dry or tickly. Some type of core. Lack of appetite, people don't want to eat that much. Although the patient may feel hot or cold, the temperature, if measured, is normally or only slightly raised. Okay, that is interesting. They're saying here that the temperature, again, this is not medical advice, they are saying here that the temperature is not or only a little raised. That is interesting. What the person can feel, the person can feel hot or cold. General feeling of lack of energy, so people feeling less energetic. Duration. The incubation period is approximately 2 days, so around 2 days after the people has gotten the virus in. Symptoms usually last at least 3 days and subside over the following 3 to 7 days. 3 days, do they say? And subside over the following 3 to 7 days. So again, 3 to 7 days. So 6 to 10 days, do we say? The nose may run or feel blocked for up to 3 weeks afterwards. Up to 3 weeks afterwards. The infection of 10 days plus 3 weeks. Causes. Numerous viruses. Colds are not caused by getting wet or physically cold, but infection is more likely if the body's resistance is reduced by factors such as chronic illness, fatigue, stress, or depression. Okay, colds are not caused by what colds now? The cold, so the common cold, so the virus cold, is not caused by getting wet or if a person gets physically cold. But it is more likely that the body's resistance is reduced if a person is chronically ill, has fatigue, stress, or depression. Complications. Colds may trigger off other secondary infections in the lungs, sinuses, or ears. Okay, then can get other infections based on the same common cold, or of another infection somewhere which is already there, or they're more likely to get it. I think some are all three. And then the sinuses, the ears, and the lungs. Treatment in the home. Keep the patient's temperature down. Although the patient may feel cold, his temperature may actually be raised. Do not wrap up in extra clothes or blankets, and do not heat up the room excessively or sit in front of a hot fire. Rather, allow the body to lose some of the excess heat being generated. Babies are particularly vulnerable to overheating. They should be kept in a comfortable, warm room and wear as little clothing as possible to prevent dehydration and convulsions. I don't know what convulsions are. Okay, they are advising here that people should not make it in particular warm. Tepid sponging may cool and soothe children. Whatever it is. Take extra drinks, especially cool drinks, to replace fluids being lost and to cool the body. People should drink. Lack of food is not important. Lack of food is not important, but fluid loss makes the patient feel worse, and the babies can be dangerous. Babies should, if possible, be given additional water or diluted fruit juice between milk feeds in sufficient amounts to produce at least 3 wet nappies in 24 hours. Okay, people should. They are saying here, lack of food is not important. Again, this book's from the 80s and this is not medical advice, but I think that's an interesting thing. Lack of food is not important, but fluid loss makes the patient feel worse. In particular, babies, that's important. Take painkillers in recommended doses. This helps to keep the temperature down. Now, is the temperature raised or not? Whatever. As linctus or core mixture may ease irritation, cause symptoms. A linctus or core mixture may ease irritation, cause symptoms. Something or something else may ease the core symptoms. Steam inhalation may help. Be careful not to expose children to the danger of scalding if boiling water is used. Whatever, boiling water is dangerous. Do not smoke and avoid tobacco fumes. So don't smoke. Do not use nose drops. They may appear to give immediate relief, but can cause the nose to become more blocked. Again, this book is from the 80s, and I don't know if it was more later, but we're saying here, do not use nose drops. They may appear to give immediate relief, but can cause the nose to become more blocked. A walk in the fresh air may ease symptoms. A walk in the fresh air may ease symptoms. Why? Why? Why should the symptoms ease? Is it just because the mind is distracted? Is it because other sensors and its other sensors are sensing other things, like the feet are just walking, and now there's more to measure. Yeah, over time, I want to come through. Extra sleep or rest in bed assists recovery. Okay, they're saying to sleep a little more, but to rest may assist recovery. When you consult a doctor, colds get better on their own. Doctors cannot cure them. Okay, they cannot be cured, but they get better on their own. Antibiotics such as penicillin are of no value unless there are complications which respond to them. But the doctor should be consulted if, okay, there are no antibiotics, but if there are complications, then these antibiotics can be used against complications. And they say that people should consult a doctor if there's a chronic lung disease, such as emphysema, so if people have a chronic lung disease, green or yellow phlegm is being caught up. People should see a doctor if they're calling up green or yellow phlegm, or phlegm, or whatever it is, how it's pronounced. Then you should see a doctor. This right here. A raised temperature persists for longer than 3 days. Earache or a runny ear develops. So if people have earache or a runny ear, they should also see a doctor. A stiff neck develops that cannot be bent forward. For children, should consult a doctor. People get a stiff neck. They should then consult a doctor. If crying is inconsolable, do we mean how the child does it? For children, you should consult a doctor. That's for children. If the temperature cannot be reduced by removing clothes, tepid, spongy, and extra fluids. So for temperature is that. If the crying keeps going, if the child becomes drowsy and unresponsive, if the child vomits more than twice, if there is difficulty in breathing or noisy breathing, what the doctor might do. So it's also for children, but I think if an adult has this, also consult the doctor. What the doctor might do. Look for complications. Look for complications, particularly chest infections or in children ear infection. If there are complicating infections, we may prescribe antibiotics. Prevention. Regularly exercise, stop smoking. For some time, non-medical sources have recommended regular large doses of vitamin C as prevention, but there is no medical evidence that this is beneficial. Okay, they're saying do sport or fitness or stay fit, do exercises. It doesn't have to be always a full thing. But again, this is not medical advice. Regular exercise, stop smoking, and for some time, non-medical sources have recommended regular large doses of vitamin C as prevention. But there is no medical advice that this is beneficial. Outlook. No long-term problems if secondary complicating infections can be avoided. So if no complications happen, then it should clear up and get completely fit again. Now this was the medicine part. And now we're going to the fitness part. Now, if you were here for medicine, you can go to the next part of medicine. What did I say? Expert of medicine. if you stay here and participate in the short stretching 2 minutes, then it's better the arm. We are having the next any. Shall we fight apart the breathing as we have so? We will go over to one side. In and out. And go over to the other side. In and out. Out and down. Breathe again in. Out one hand slides down the leg. Breathe again in. And out one. Breathe in down the ribcage. Out into the middle. Breathe in. Out one arm down. Again in. Out one arm over. Breathe in down the ribcage. Hold it on down. And feet standing together. Breathe in the feet up. Breathe out one hand down. Breathe in and reach into both directions. Up and up. Again in. Out one hand down. Breathe in and reach. Out and up. And hands down. Now feet standing shoulder wide apart. And we're doing shoulder circles. Go back. Here, front. Down. Up. And front. And down. And backwards. Front. Up. Back. And down. Front. Up. Back. And down. Now breathe in the arms up. And breathe out, bring your arms down, hanging down the other forwards. Breathe again in. And out down the leg. Breathe again in. Out over to the other leg. Breathe again in. Out into the middle. And breathe in. And out comes slowly with the down, back up. A good shoulder shower. And breathe again in, go down. And breathe out. Again in. Out. And breathe out. Cross legs. And breathe out. That was also 120 seconds stretching. But nevertheless, I think we will watch end next time.